Good morning, Sarah. How are you?
Good morning. I am just great. How are
Actually, we
you?
are good afternoon, but I just
It is
realized that.
12:30. Good
Yeah, there you
afternoon.
go. We are both in Central Time now, which is awesome.
Yay!
Yay. I'm very well. How are you, love?
I'm doing well, doing well.
Awesome. So, we're going to talk today a little bit about sequential therapy and what that is and why we do it and why is it under the Heilkunst umbrella and what the history is around that. And then we're going to talk a little bit about some cases, not in a specific way, but more in a general way about how this all works as we go along. So your job, love, is to keep me honest and make sure that I don't get too heady with the principles. And, you just insert yourself as we go as a student of the Hahnemann College, just make sure that this is accessible to all.
Okay, check, check.
All
I
right.
can do that.
Brilliant. I know you can. All right. So, Heilkunst, really was attempting to weave its way into the British Institute of Homeopathy, and a lot of people don't know that. Is that way back in the late 1900s, we were actually running the British Institute of Homeopathy in Canada, and it was the course specifically for training individuals in homeopathy, and we had module 10. And I know because way back then, before I trained in Heilkunst, the 20 years, almost 20 years ago, I actually was the one that put the course material together for the British Institute and shipped it all over Canada and the United States. And
Cool.
so, yeah, way back then, a lot of people don't know that was run by Rudy Verspoor and Patty Smith. Patty being a homeopath from the U.S., the Jersey, and Rudolph Verspoor here, and he was in Ottawa, Canada at the time, and they merged both professionally and personally, and started to really find that they were experiencing some limitations in their practices, and to serve their patients better. There was actually a moment when Rudy was flying back from France to Canada, and he went into the airport bookstore, of all places, and found a book called Rediscovering Real Medicine by a Swiss physician by the name of Dr. Almaguer.
I had not heard this part of the story yet.
Yeah.
That is awesome.
Yeah.
So Heilkunst used to be back in the early 1900s more widespread and more well known.
Well, and Heilkunst was a word that was coined by Hahnemann,
Yes.
Dr. Samuel Hahnemann, who from 1755, he was born in Meissen, Germany, and lived for 88 years. He used the term Heilkunst, and it was interesting because Heilkunst wasn't really fully formed until about the year 2000. And again, it wasn't founded, the term was not founded by Stephen Decker, Rudy Verspoor, Patty Smith. It was actually Hahnemann's original
That's right.
system. So he wrote kind of what we call the Bible of Heilkunst. It was a book called the Organon der Heilkunst, which really in English translates to the whole medical art of healing and curing.
Okay.
Mm-hmm.
And just for those other people that may not know, Samuel Hahnemann was German.
Right, exactly. Right. Well said. And so as a German physician, he was very bright. He spoke 12 languages and translated effectively in 8. And it was the translating he was doing on Dr. Cullen from Scottish English into German,
yes,
where he noted the use of quinine in the prevention of malaria. And that really kind of started his, because vaccines weren't a concept way back then either. And he was like, well, maybe there's an application here based on what Hippocrates had said was that first cause no harm. But he also said based on the law of cure, like cures like. you really need to apply that principle in order to resolve a disease matrix. So this is something that Hahnemann was floored by. And so, yeah, based a bit of history is that he actually started to research the law of cure. He started to take remedies derived from animal, mineral, and plant sources himself. He offered them to students at the university as well. What doesn't kill you makes you stronger. And I think they did get a little sick, taking quinine.
Doing approving.
Yeah, doing approving. Yeah, well said. There was some vomiting and diarrhea, and then science was girded with the knowledge of the materia medica is that, if a patient comes to you with this symptom picture, if you give them that specific remedy, you can cure it outright.
Right.
Yeah. So Hahnemann understood like the tonic root cause. He wrote 2 volumes on the chronic diseases, as you know, in your studies. And what he recognized is that if you give the homotonic remedy, and that's all there is to it, you can have a good rate of cure. However,
and the tonic, remind me again of what the tonic and the the tonic is just the symptoms and stuff that you have. It's not I'm forgetting the two
Yep,
kinds.
You're good. So tonic diseases are the root cause or chronic diseases. So a perfect example would be how we have them ordered, and just excuse my very messy map, but psorinum or psora, as you know, Hahnemann, that was one of the first diseases that he recognized. Okay. And then he called tuberculinum pseudopsora, metaurinum he called psychosis. And he really kind of had those big 3. He had done so much research on 88, in his 88 years of 100 homeopathic remedies. And because he had just really discovered the system of medicine in his 40s, he only had 40 years really to nail down what he did. And oh my gosh, that happens to be a huge amount of knowledge, materia medica, the chronic diseases, his lesser writings, and then the Organon der Heilkunst. That's the tenets of this entire system of medicine. And, a portion of that was used for 150 years, but really the root cause in a sequential way did not come to bear until Dr. Almaguer's book, Rediscovering Real Medicine, came out in the 70s and then was really discovered and integrated into the fuller system of Heilkunst medicine by Rudy Verspoor and Patti Smith.
So it's just an example of, someone figuring these things out and learning them, but he even said in his writings, he didn't even always understand why they worked or why it was. But he passed that knowledge along down the way where, the next person kind of down the line was able to use his knowledge and then add their own knowledge and bring it up higher.
Right.
And figure it out even more.
Right. For people to have the basic tenets of like cures, like the problem has been, though, is that we've been treating it very much up until recent, like the allopathic physicians. What you see, take a shot at that, and hope based on trial and error that that's going to work. We haven't been really succinct in methodology. We have not been scientifically succinct in that we're using really the methodology throughout the case. So, as Rudy has written, I'm scrambling because I'm trying to think of the actual book because I've spent 20 years studying the Hahnemann's works through Rudy's lens, and so. Not sure where he said that, but what ends up happening, and Hahnemann knew this too, is that pathic diseases, which spawn from the root or the tonic, the mother disease, is a layer.
Right.
And it gets rather confusing if, for example, you have the chronic disease of cancer, then you have Natrium muriaticum, which is what we call allopathic disease. All of a sudden, you've got headaches over the eyes. Patient can't get to sleep at night. They're watching the clock. They've got constipation and then diarrhea, and they've got these colds that keep coming up and sinus infections, as I did. And all this stuff is all what seems very chaotic. And so all system of medicine, so for example, if you went to an allopathic with those symptoms, you'd get a tryptophan drug to suppress the headaches, and maybe some Dristan for the sinuses, and and you're sent on your way. And the same too if you went to see a homeopath, and this is what we really were doing ourselves way back 25, 30 years ago, is that, give them Bryony or Natmir and send them on their way.
Yes, exactly.
Right? And be done with it. But damn it. In both
but then those symptoms would come back again.
Right. Exactly.
So that you haven't, because what it comes down to is you're not finding that root cause. And I find in, the name has slipped my mind again, the functional medicine that's become much more popular now. That's one of the key phrases I find that they use a lot is, getting to the root cause. But Heilkunst actually gets, I guess you could say, a little more to the root cause.
Yeah, well, and it's
deeper.
The only system in the world, and that is actually taught at the Hahnemann College for Heilkunst, and there you can find them at www.heilkunst.com. So I want to just make sure that we give them their due, because they're the ones that have enabled me to cure the underlying cause of diseases for close to 17 years now at Arcanum Holistic Clinic. So yeah, all of the credit goes to the research that they've done. All I do really is, I'm like the Heilkunst for the dummies version, because
she's really not. I'm
the puppet that's practicing exactly what I've been told are the tenets and the edicts, and following this methodology.
Yeah. And from what I understand too, from the part I'm in my studies, definitely don't have 17 years experience yet, but those tonic diseases, those miasms that we talk about, those, when they're not addressed, they cause these symptoms to come up, which is really just a little flag being waved in front of us saying, hello.
Yes.
Take care of something.
You have not gotten the root.
Yes.
So yes, you have addressed some of the pathic disease, sometimes all of the pathic disease, but you have not annihilated the cause. So yes, we may have treated, and again, I'll get to the timeline in a minute, and hopefully it's not backwards. But if cancer is still at large, you can give Bryony and Natmir to your blue in the face. You're not going to see these symptoms of the tonic the roots for chronic constant disease resolved.
Right.
It's still at large, and it's still going to find another way, whether that's a tumor, we'll see the unlived life, feelings, skin issues, tummy troubles, breast tumors, lots of issues in sex organs. We all know that 80% of cancers show up 80% of the time in women. So that chronic root is still there. You've just addressed kind of the noise on the surface. And this is precisely what Hahnemann figured out, was that the pathic diseases are actually layered on top of the tonic roots.
Right.
And if you only address one aspect, you actually have not cured the case.
Right. We really are an onion.
Right. We really are an onion. And allopathic medicine could go longer or further if they understood that every single case is layered this way. So the modality of treatment needs to respect the law of succession of forces. which means that you can't get away around it at
Right.
all, because the root cause will always angrily show up more symptoms if you do not address it sequentially.
Yes. And not only like physical symptoms, I found that it comes up in environment interactions that you have with people, emotionally, obviously, too. Even, relationships that you have, issues that keep coming up in relationships, until you actually deal with it.
Yeah, well said. So a perfect example of what you're illustrating is that I was serving a patient years ago, and she was working on a timeline event and around here of a marriage 22 years ago in the past. And when she was working on that specific timeline event, don't they both meet in an airport across the country for her, across the world for him, and have coffee that month that she's working on that event?
Yes. Yes.
And they closed down the tendrils of that, 1 year romance marriage that occurred where they had a quick divorce. How is that possible? So that's really what you're alluding to, is that it really starts to send the dynamic essence of the case into occurrences, mental, emotional, spiritual, that whole realm starts to get very kind of conscious. It's a strange thing. And people that have not gone through this system of medicine will go, the hell are they talking about now?
Yeah.
But I'll get clear about that now, I think is the time. So a patient first comes in. I'm thinking of many individuals I serve. They're on 5 or 6 different medications, and maybe they have a partial or full diagnosis of cancer. I'll stick with that for now. And they're really not sure what to do. Doctors are telling them different things. Alternative therapists too, make sure you alkalize the body, lots of green juices from the, and here's a homeopathic remedy for this specific type of skin cancer. Scrinum is a homeopathic remedy, could be any pathic remedy. And so, and usually, like I say, not any, but well-selected homeopathic remedy for what's showing up in the present. Doctors, of course, are going to say, we need to do some tests, and you may qualify for radiation, chemotherapy, or we're going to use surgery to take it out, remove it. But we all know that the cases of cancer coming back in 2 or 3 years, because you've not sequentially addressed the root, is still going to be an issue.
Right.
Right. The cases of recurrence are extremely high.
Yes. Yes.
Yeah.
Yeah. That's what they actually tell you.
Yeah, totally. So the idea being is that if we take a person like an onion, and like I say, everything's very complicated. In the beginning, there's iatrogenic disease, which is what we call drug-induced disease. So you're trying to address, and a lot of people who have the cancer miasm, you're going to see thyroid medication. You're going to see medication for the migraines they may be suffering. They're going to be on a water pill. They're going to be on, medication to help them sleep often. I mean, it's a bit of a crap show in the beginning.
And iatrogenic diseases are the side effects you have from medications, correct?
Right. And they're considered a disease all on their own, because they are suppressive. They're not curative. They're suppressing or palliating. And that's really the only jurisdiction in which they can act. It's not their fault, right? It's not the drug's fault. They only have one job. If you think of the words antihistamine, let's take antibiotics, for example. Again, people with cancer in the beginning often have a lot of sinus infections. Well, what happens? They give them antibiotic. Well, what does that literally mean in the Greek? Anti means
life.
Bios is life. You're right.
Yes.
Yeah.
Yes.
So it's against life. Well, that's not creating health, right?
Right.
Yeah. And antibiotics have their place. You want to shut down a disease that's, crazy rampant, for sure. But what do you do with that iatrogenic disease? And what do you do if the cause is cancer and you've just sent the patient on their way? It's actually not ethical medicine.
Right.
Because they're still at large with their original tonic and pathic diseases.
Right. And to clarify, the palliative and the suppressive drugs of what most allopathic medicines do, most of them are suppressive, where they I'm drawing a blank.
Yeah,
of how to say it.
Right in. Yeah. So if you think about it as an example, the two places that allopathy uses homeopathic principles is in vaccines and Ritalin.
Mm.
Right? So on the law of nature, like cures like, they're actually
Right.
giving some of that disease matter in an attempt to convince the body that it's already had that experience. So if a child is hyperactive, you give them Ritalin. You can also give them a sniff of coffee, and they will even out for a time. The problem with crude nature with the drugs is that you actually have to keep giving them because it's not curative, it's suppressive, and it's suppressive for a time. And we know they're not curative because you remove the drug and what's still there is the disease.
Yeah, that's still there.
So, for example, tuberculinum, if you keep giving for bronchitis a drug every year around Christmas, because tuberculinum's predisposition is for December 21st, you've got to keep giving it every year. And it keeps coming back with a vengeance. You hear that from your patients all the time when you're in practice, is that, oh my gosh, I got this bronchitis and sinus infection again. I'm always out at Christmas. What the hell is going on, right? Because the root cause, again, the sequential therapy approach has not been respected. So even though you keep shooting at it like a video game up here, you're actually not addressing the tonic root.
Right.
So yeah, functional medicine, it's interesting because there's a lot of, words, terms being dropped. And yes, there are, they're getting closer and closer to this realization. But in Heilkunst, we're already there, and we've been there, because Patty and Rudy took the time to research back in the 90s, and Stephen Decker retranslated Hahnemann's original works, the Organon der Heilkunst, and realized, holy liftin', there's a whole dynamic system there that we can actually get closer to a 98% cure rate without causing an ounce of harm and not suppressing.
I love it.
Yeah, me too. Me too. Because there's nothing more rewarding than putting up another testimonial on your page, on your web page, to say, yeah, here's another kid out of the spectrum. Here's somebody that doesn't have, the cancer anymore and isn't suffering bronchitis every winter. I mean, yeah. And the thanks that we get is, very fulfilling.
Yes, I know. We haven't had any coughs or sniffles at our house yet this year.
Yeah, awesome. That's awesome. Yeah. So in essence, you're right. And now, we're quite a number of years further, and Dr. Almaguer even talks about this in Rediscovering Real Medicine, that cases have become excruciatingly complicated, and it is. It's hard even as a Heilkunstler often to, weed out what is the disease, what is the side effect, what's the pathic disease, what's related to the tonic disease. And so in the beginning, when you first get these very complicated patients, it's like, oh, geez, where do I start? Which linchpin do I pull? Which remedy do I give? I mean, this has been, medicine's folly for hundreds of years. It's like, really, I want to serve this person to my best capacity. And the first aphorism in Hahnemann's Organon der Heilkunst is, physician has one job and one job only, and that is to cure the sick. No other messing around. It's unethical to do so if you're not addressing the roots. So in essence, things are very complex in the beginning. So, I'll give a detail. The emotional support dropper helps with some of the emotional aspects. NSOL, which I've spoken about in other blogs, and We'll do specifically a piece on that particular remedy complex is Natrium muriaticum, opium staphysagria, and lachesis, really to address emotional aspects of grief, anger, fear, guilt, shame, resentment. Then you just give a nice little constitutional remedy in there. And again, that's a whole other area to be discussed. Constitution helps to buoy up the person's life force. Often there's remedies like lacumanum in there, which is mother's milk for nurturing, because we're all so damn unnurtured. There can be remedies in there for overwork, like Oro. There can be an anxiety complex that we use. There can be a good ton, small number of flower essences. So that really is for the person to take a drop per day or sip on as needed. The other aspect then is the drainage and organ support. That's where we actually put a couple of in low doses, the genetic miasm specific to that case, so that we're lapping away at the tonic diseases at the same time as we're starting to resolve the underlying cause. In that dropper bottle will also be the iatrogenic remedies for any drugs the person's on, because you want to make sure you're detoxing them out of the liver because they're fairly toxic. Over time, what we tell them, we never tell a patient to go off their allopathic drugs ever. Never. So it's up to them to work with their allopathic physician. The trouble is that most allopathic physicians are not used to their patients coming off their drugs over time because they don't need them anymore. So we have to kind of coach the patient that yes, indeed, this will happen because we're working on the underlying cause. You won't need those drugs. Now, I had a woman last week who is taking nitroglycerin. She'll probably never be off that med. And that's kind of the 2% in Heilkunst medicine. We're not able to, repair tissue damage. In children, we have much better success with chemotherapy and other jurisdictions in Heilkunst that are able to resolve their issues and help to regrow tissue. But you're not going to repair a broken heart.
Mm-hmm. Okay, so most patients you'll give them a remedy specific to, well, we haven't quite gotten into that yet, their timeline events, but right. Then they always have on hand an emotional support dropper.
Yep.
Which is literally like a dropper bottle with liquid in it, and then a drainage support also.
And organ support.
Yes, drainage and organ support.
Totally.
Yes.
So those are kind of, again, those are just as much the spine of Heilkunst medicine as, so we want to be lapping away. And people say, well, why are they in dropper bottles? Well, it's because we put them over a larger surface tension. And on the law of nature, like cures like, by taking them regularly, you're lapping away at things in the present.
Okay.
At the same time as we're going back to address tonic roots. So in essence, those dropper bottles are to actually handle the pathology or the pathos, the pathic diseases that are all in a state of chaos. So you want to be kind of quieting the noise of those symptoms en route to the cause. It's a form of management, really, as you keep your eye on the prize.
Yes.
Yeah.
They work too.
Oh, believe me, sister. Yeah. After all this time, I still,
when you email Allie with an issue you're having, are you taking your dropper?
Your emotional support and drainage and organ support. That's the first thing we ask.
Sip on that. Sometimes I wanted to say, I'm sipping on it.
And in cases that are more protracted, some patients will have, an additional complement of a number of remedies for right knee or left shoulder or neck pain or back pain, whatever it is. They'll have a third or sometimes even fourth dropper. But what we find is even those droppers fall off. They don't need them as, again, we go down through the timeline, and people may be asking, well, how do you do that? And, it's the same law of cure. So for example, let's say recently the patient had an event with antibiotics. They had a sinus infection because they have a strong predisposition to this cancer matrix. And again, you're going to hear me making correlations I haven't explained yet, but I'll try and get there. So the sinus infection, you go off to the allopathic doctor, and again, rightly so, you've got something out of control and a lot of green and yellow mucus. And, this is the way that in most people's minds, this is the way you handle infection. You give an antibiotic to shut it down. So what ends up happening, and again, antibiotics are not an informed remedy. They go after the whole bloody terrain. So the first thing we say is, oh my God, get yourself on some
probiotics.
Woohoo! Yeah, which really speaks to the last talk that you and I did on YouTube. So look for that. Yeah. Yeah. So, which is excellent. Get some fermented foods, probiotics, organic yogurt, and get her done. Several billion Acidophilus and Bifidus will help to recolonize the gut, because the antibiotics just wipe the whole bioterrain out, right? Which sends the immune function down the crapper, right? You want to build the system back up, not be anti-lifing it.
Right.
Right. So the homeopathic complement or series for that would be penicillinum. And then we make sure we clear it out with what we call the ANS combo, being Nux vomica, sulfur, and arsenicum. And that helps to remove that disease. And we give a series of potencies. And again, we've studied this for 24 years under Verspor. I'm not going to give the whole thing away, because you need to go and study at the Hahnemann College if you really want to know how this is done and what potencies.
That's right.
Yeah. Yeah, that's just the way it works. Yeah. And then the next event on the timeline comes up 28 days afterwards. Typically, the patient will actually automatically start to show the symptoms for the next event on the timeline, which I think makes the system the most elegant in the world. You don't get that kind of elegance in any other system of medicine. So I have a great example in sequential therapy where my son, had fallen off a bed when he was a kid. And we tried to actually skip that timeline because I felt really guilty about it because he'd broken his collarbone. And so we skipped that timeline, went to the next one, and he woke up the next day. Oh my God, my neck, and I was like, oh honey, what's wrong? Like, what does it feel like? Oh, it feels like when I fell out of the bed in New Brunswick and broke my collarbone. I was like, oh my God, that timeline event. And I called Patty, and she said, yeah, it's not here. And I'm like, oh shit, causing this kid harm by missing timeline events. So we backed up and we treated that and resolved it outright, and he didn't have any symptoms related to that event at all anymore. But that often will happen, and it surprises the patient. And what I love about it as a physician of Heilkunst principles is that it is so sound. When I think there's so much chaos, the life force every 28 days, like a lunar cycle, goes, no, this is where you are on the map.
Yeah, it's not as chaotic as you think it is.
No, the body never forgets the trauma that it has sustained in the order in which it sustained it.
Right. Yes. Yeah, because and also the pro that I always think it means is you get to have an appointment with Allie every 28 days. But I know from experience, I'll email or call up, almost in a panic. Well, this is happening. This is happening. This is happening. Why is that? And then the amount of not even relief, but just like, oh, when you explain it to us and make the correlations of, yeah, this is what's next on your timeline. That totally makes sense that this is what it is occurring in your environment, in your life right now.
Yeah, I love that. It is, I think, no better feeling as a physician to be able to say to the patient, well, look, this is the hay wagon you fell off, or this is the event of the death of your beloved grandfather, and that's why you're having these symptoms all related to grief. That's exactly how it's going to display. And you can go right to the Materia Medica and actually, read it. And the patient's like, oh my gosh, okay, how is that even possible? That you
Yes.
have the principles and the logic and the methodology to be able to, and I remember in the beginning, I was like, oh, Patty was bloody brilliant because she knew her Materia Medica cold, and classical homeopaths do. They're absolutely brilliant. They know hundreds of remedies in great detail. And I was like, oh my God, Patty, how am I ever going to learn all these remedies? And she said, with Heilkunst, it's not that hard. Because once the pathic diseases are addressed and you get down to the birth trauma, then you just have the 8 genetic miasms left, and the patient's only going to be showing symptoms for these.
Yes.
So it gets easier and easier if you're, a good practitioner and a good student, and the patient starting to really understand the formula. Things get really quiet, and it's
then
really
we stop emailing as much.
Totally. In the beginning, and it's always 12 to 15 days after the preceding remedy, and then that's when the phone and the emails come. Yeah.
You don't have a clue.
That's right.
Diane.
Yeah.
Help again.
Yeah. I love our office manager. She fields so much of that for us. So, yeah.
Oh, yes.
Yeah.
So I was going to say, when you were talking about the, what the body says, I just happen to have this book out next to me. But though, like you were saying, when you read to us what, the things that we're complaining about, I would always just be like, oh my gosh, it's just like you went into my brain and listened to all those things that I didn't even realize that I believed myself. But on the other hand, I knew I believed. And
what
it's no coincidence.
Right. It's no coincidence. And you're right. What you're pulling from is another jurisdiction of Heilkunst medicine, which is called the ideogenic, or spiritual diseases, or core beliefs. And that's really, that wonderful book that you just picked up. Famous homeopath Dr. Rajan Sankran gave us state-based or state of mind-based prescribing, which has helped us enormously. And Messages from the Body by Michael J. Lincoln. Phenomenal resources to be able to say, okay, this is how this state of mind has contributed to this layer in the disease matrix. Yeah, this is a whole other area we need to do a session on as well, which is Dr. Paul Herskew's tonic realm.
Oh, yes. I don't know much about that yet.
Yeah.
Oh, well, I know about fears and terrors.
Yeah. Yeah. And when you study that in your course material, it'll open up a whole other level in the whole sequential process. So sticking more to this area here, when I can read out of the Materia Medica, these are your symptoms related to bryonia. This is why you're getting the headaches over your eyes, is because you're bumping into this big grief event of your grandfather's passing on your timeline. And it is, yes, related to the cancer miasm, feelings of the unlived life, rescuing others to the exclusion of self. But you'll see people with a strong cancer miasm, a whole series of losses on their timeline, syphilis, a whole series of insidious self-destructive, a lot of injuries on their timeline. So once you have an understanding of the roots, you can start to really see the elegance in the way that it's layered and set up, and why you have to treat it sequentially, and why the cures won't hold if you're just shooting at it like a video game.
Right.
And and the patient's walking after that. So as we go down the process, penicillin disease, iatrogenic disease, then the death of a grandfather, and then perhaps a broken bone. And again, 28 days later, patient will say, that ankle 3 years ago that I, on the volleyball court that I turned on, and what a sprain that was. Allie, I don't think your Heilkunst medicine is working because it's starting to hurt. You're giving me these dropper bottles and you address these 2 months of issues and
it's not
costing
working.
me money. It's not working. This ankle from 3 years ago is starting to flare, And then the biggest part in Heilkunst medicine, as you have alluded to, Sarah, is that it takes an enormous amount of education month after month to explain exactly what the phenomenon is and why it's occurring.
Yes, it's a friend and I who we're both doing Heilkunst treatment. We've talked about how everything that happens and even the feelings that you feel, you learn to stop and ask yourself, okay, is this real or is this a result of what I'm working through this year? And it feels really, really, really real, but I feel like it's doable because I know that I'm going to get through it. This is just a temporary feeling. And if I think one of the biggest lessons I've learned from all of it is to feel your feelings about everything. And I was actually just reading an article about that this morning about how negative or quote unquote bad feelings get a really bad rap, and we're not supposed to, oh, just be positive, just be positive. And I know I've been guilty of saying that too, but how much it helps to just let yourself sit in those bad feelings that you're having and not question why you're having them or I shouldn't feel this way or anything like that. Just go ahead and let them feel and cry about it if I need to or anything like that. And then you've acknowledged them, you've honored them and let them go.
Yeah. And you're actually, because you are such a seasoned patient,
I'm jumping around all the
No, you're good, love. It's the third jurisdiction of Heilkunst medicine. These are the highest diseases that you're referring to. And again, this being the whole map of Heilkunst, your regimen is so sound because you've done so much work for yourself and your family to make sure that you're getting ferments and probiotics and, bone broth and remineralizing, teeth, as you talked about last YouTube video that we did. And then this is the realm of the bioresonance technologies of actually stripping the onion in order. In sequentially, this was all designed by Stephen Decker and Marla Wilson, who were the mentors to Rudy Verspor and Patty Smith. So the area that you're telling me, that you are focused on really is the most advanced level. Yeah, because it is
so excited to be at the top of the class.
Well, and after you've done as much sequential therapy as you've done, the core beliefs, again, going back to our sequential map, are what dictate the fears and the terrors, which dictate which chronic diseases or tonic diseases you've chosen during the course of this lifetime to challenge you the most so that you can transcend and cure them to become your whole, healthy, essential self. I mean, really, that's the goal of treatment.
Yeah. Yep.
So again, knowing that it's layered and that it has to be strip mined in a sequential order, then you get down to the vaccines. And again, this happened last week with this tiny patient I was serving. All of a sudden, after we had stripped the preceding event, he developed a fever. And the fever is telling us that we're about to bump into his vaccines. So then we remove the shocker trauma to that actual vaccination trauma. In this particular case, it was the MMR, measles, mumps, rubella vaccine. And by removing that trauma, the fever lifted. So very, very typical. Then we go after the next series of vaccines because most kids now are being given 80 by the time they're 17 years of age, which is entirely unethical because there's no proof that those diseases have become, and in 30 years, there's been no tests on the efficacy of the materials put in those vaccines. So entirely unethical medicine. Then you address the birth trauma. And Not all births are traumatic, but a good 85% of them probably are, because forceps, a good spanking on the bottom when I was born in 63 was quite normal. Trauma to the cranium coming down the pipe. Also, C-sectioned babes not had that big gulp of their mama's microbiome, so we have to get in there and mimic that having actually happened through the birth trauma. We had a lot of headaches. People will have a lot of dreams about being pushed through the mouth of a Coke bottle or in water, which is so cool. That's the best part of Heilkunst medicine for me is all the related occurrences. So people dreaming that they're drowning get that a lot when they go through their birth trauma, which is an endless source of interest for patient and practitioner.
Yes, it is.
Yeah,
you're right.
Totally. So I don't even know how anybody gets any satisfaction from, using other systems of medicine, because it's like, oh, we'll just give a drug to shut that headache down or take some acetaminophen, which now has been proven by the FDA to increase asthma and la 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 la. What's the other thing?
Yeah, I was just reading about that too.
Yeah, it'll come to me. So by 50%, acetaminophen, Tylenol is by the FDA said increases asthma, and the other thing I'm trying to think of by 50%, which is a lot.
Was it liver disease?
Yeah, it could very well be.
But it was, because I was reading and saying that if it went through procedures today to get approved by the FDA, it wouldn't pass.
Yeah, it wouldn't pass.
Which is saying something.
Exactly. It is. Yeah, because again, it's suppressive and not curative. So again, you miss the opportunity. So let's say, somebody comes in with a headache that's related to an unresolved birth trauma from forceps. You lose the entire opportunity to really understand what the root cause is.
Right.
And how that relates to a person's consciousness. Being yanked out of the birth canal by a set of forceps has implications for that human being, on not just physically, but mentally, emotionally, and spiritually. They weren't ready to be born.
Right.
You've screwed up now the whole time that they weren't even supposed to be on the astrological chart at that time.
Yeah, I'd never thought about that.
Messes up so many things dynamically that we just don't understand. But with sequential therapy, we can start to rebuild that essential self of that person the way they were meant to be before the trauma engendered a disease of either apathic or tonic origin.
Right. That isn't dealt with at first, and so then it just creates
festers all kinds of bloody problems. And the life force is designed like that. It's a hierarchy. It's like, yoo-hoo! No law of cure on this sucker here. So I'm going to be turning up the volume over time. How do you like me now?
Yes, which is exactly what happens to us as we grow up and become older and older and older. Our symptoms start getting worse. But, is that really what we call the getting old?
Yes.
Because that's the phrase you hear all the time now. But is it really? I just haven't dealt with what my stuff.
Right. Because we should naturally live about 120, 130 years when we just say, you know what? I'm done. I'm going to walk off underneath. Native people did this for hundreds of years. It's time. And I know between me and my maker that I came here. I did what I was, ordained to be and do. And it's time for me to walk off under that big oak tree, lie down, and have a really long nap.
Yes. Yeah.
And in health, that's really how it comes to play out. But yes, everybody says, well, he lived a long life. He was in his 80s. And I always ask when I'm doing the initial consultation, well, what did they die from even in their 80s? Well, natural causes. And I'm like, really? So, they had a heart malfunction or their lungs filled up. I'm thinking that's not natural causes.
You're right.
Yeah. We're conditioned of, so many years of allopathy to settle for.
Yes. Yeah, that's so true.
Yeah. So when people go, well, I'm 50s, things are starting to break down. It's like bullshit. I don't wear glasses. I'm 55. I'm on no medications at all. And I'm still a going concern.
Right.
Yeah. And we'll be writing cases into my hundreds, I'm sure, causing all kinds of
Thank goodness.
trouble. Getting into all kinds of trouble. So this is the part that I am most excited to explain, is that we clear the birth. So we've done this whole sequential therapy path right down to the patient's birth. And they do the craziest thing. Because if you think about it, it's really interesting. And based on Elmager's understanding of the order of disease matrices, is that we are starting from the most recent disease to a patient in real time and working our way back to birth.
The oldest.
Then the oldest to newest to oldest. And then they do something crazy on you.
Switch it up.
They switch it up. And again, Heilkunst, based on observational science and scientists since Hahnemann's time, recognize that after clearing the birth trauma, the patient actually starts itching, complaining of a little cold, freezing cold feet and hands, have to wear a hat even on the warmest day. And they're suffering poverty consciousness. I'm not enough time, energy. And it's like, how did they know to go from dreams about water and their birth trauma to the oldest genetic miasm on the planet? Yeah. Blows me away.
I never realized that it went from, but it is, yeah.
Yeah. So after thousands of years, this disease is thousands years old. It's leprosy in the Bible, it's arms falling off and limbs scabies. These are words we don't even use in, modern times. Can't even say 2018, that patient has scabies,
Yes.
That's psoriasis sorinum. What have we been putting on it for, in all the years of modern medicine? For 100 years, we've been slapping cortisone on it. Yeah, so it's not gone anywhere. You put cortisone on it, next thing it does, it shows up in the lungs. And then it shows up, in the more noble organs. And you just give a puffer or prednisone. I mean, it's crazy. That's not a cure. That's management, and that's suppression.
Right.
Yeah.
And so speaking to those, you've always talked about how the symptoms will show up in the lesser organs first, like with skin. And then if it's not dealt with and it's not taken care of and it's not addressed, it'll move deeper and become a more quote unquote major symptom to try to get your attention even more.
Right, totally. And that's the thing, is that if you suppress it off the least noble organ, the skin, as you mentioned, it heads in underground. The same thing, if somebody had syphilitic sores on their genitals 100 years ago, they gave them mercury cream. Well, hello, it's the most corrosive, and it drove it into the more noble organs so that people were, running around schizophrenic, crazy, Alzheimer's, You drive it in off the skin, the least noble organ. If you do not deal with it appropriately, using the proper jurisdictions on the law of nature, you're asking for trouble, and you're going to cause that person to have an earlier exit strategy, and that's not ethical medicine.
Right.
So Dr. Elmager talked about this law of succession of forces. So Sora being the oldest disease, then malaria, tuberculinum. Think about what was occurring in Europe in 300-400 years ago. People were going off into the mountains to the sanatoriums. Tubercular patients always feel better up in the pine forests.
Right.
Yeah. And then we get down into ringworm, metaurinum, cancer, syphilis, and then Lyme. Lyme is such a new disease on the planet. I have it I wrote it in about 10, 15 years ago because it actually wasn't a disease that we had identified under the Heilkunst umbrella it is the most recent one on the planet. So I won't get into this in too much detail. The reason being is that we have, information. We'll be doing a separate YouTube video on the chronic miasms. And we'll also do the tonic realm and the core belief realm and the constitutional realm. So yeah, it's so much and so dynamic. But that really kind of speaks to how we wove sequential therapy into Heilkunst and why. The methodology, I hope, is clearer for people and patients that we serve than it was before. So, Sara, over to you, love. Any questions that you have? Anything that I've said that sounds like it's
I guess one thing people might want to know is what kind of, a little bit more specifically, what does it look like when they first have an appointment with a Heilkunstler or with you, and what kind of things do they include on their timeline? Because a lot of people, should I include this? Should I include that? I always went with, if it was something that I thought of, it needed to be on there.
Yeah. And that's a great question is right there. So, medical drugs are important, vaccines, shocks, traumas of an emotional or physical nature, deaths of a parent or grandparent, and put it on if you think it might be a trauma, because sometimes it's just marking time. I have a patient says, oh, she went to start to see a chiropractor at that time. She put that on her timeline so that I kind of know when that happened. And so, yeah, that's not certainly a disease matrix at all. Burns, severe burns, a fall, sports injuries, broken bones, severe sprains, those kinds of things. I always say to the patient, pretend we're sitting in a little red car together. And yes, we're going to go over a bunch of little speed bumps. They're probably not an issue. But as soon as we hit a wall in your mind, that's a trauma that we can't go past until the life force has dealt with it. It's interesting, in my own timeline, I had the death of my parents, which was, huge. And then I got down in my timeline below those events, and I realized that I had been a competitive swimmer for, 8 years or something. And chlorine was a horribly devastating thing for me. And I didn't think that qualified. But then I said to Patty, maybe we should clear the chlorine, because I think it might be an issue, and it keeps kind of coming to me or waking me up at night or in dreams, or I think about it, when I'm showering. How come this chlorine thing keeps bugging me? I'm like, well, maybe it should be a timeline. She goes, well, Allie, yeah, it should be if it keeps kind of coming to you like that. So we put it on the timeline, and was one of the next events to clear. And oh my God, I was in bed for 2 days. I could smell chlorine in my, my sweat, and I was tasting it. My eyes got all bloodshot for a couple of days with the healing reaction. And then, I felt a ton better after addressing that event. Didn't realize it was still in my cellular matrix. And a lot of people don't realize that, 20, 30, 40, 50, 60 years. I found my mother's lithium in my cellular matrix, that transferred, through the blood-brain barriers. So a lot of people don't realize that what they're carrying around in their cells is really a residue of even their parents' unresolved sequential issues.
Yes. And so that also brings to light what you said is, lots of times if you forgot something off your timeline, like I always say, it pops in your head. That's how it happens to me. I just have this little random thought.
Yeah. And that's the art in the science of Heilkunst medicine. And why I love it so much is that there's this feminine spiritual aspect to the very logical and rational, kind of more masculine side. And I think that's part of the map that maybe I didn't reveal, but mysticism being at this pole and materialism being at this pole, this being chemical science, this more being, spiritual science based on anthroposophy and Rudolf Steiner. When we actually have a speedboat that's going down the center with regards to phenomenology and principles and epistemology. We can really actually be a true science that respects these two polarities, but is not one or the other.
Right.
So
The
the
balance.
idea, it's the balance of the borderland between those two polarities. And that really is the balance between the feminine gesture, which is more of the spiritual, the softening, the loving, the receiving. I mean, that's a big part of Heilkunst treatment. And what I received as well is a great gesture of love and care. We love our patients. You know, we take them through this process with extreme compassion and care. You know, we don't, you know, like I say, give them remedy and they're gone. Like you, they become tremendous friends and we form, you know, great bonds. And in materialism, again, it's not like you said so beautifully earlier. You know, we were talking before the podcast of somebody that you know who's had a series of health issues. The doctor says, well, I don't know how to deal with this anymore. Go to a feelings doctor, you know, and get some counseling. And it's like, well, no, if you have a sound system of medicine that honors sequentially your disease matrix, you should be a one-stop shop.
Yeah. Yeah.
You know, for mental emotional issues, naturopathic issues, homeopathic issues, and then into the realm of psychotherapeutics. You know?
Yes. Yes. You have to you just have to treat the whole patient. You can't just do here or there or pick.
Right. Pick what feels like the right thing to aim at, like a video game. And again, you know, I liken it a lot of the time, allopathy or even alternative therapies, you know, they're really just allopathy dressed up in chicken feathers, is that they're still shooting and aiming at the thing on the surface like a video game. Well, what happens in any other video game is that all the bad guys keep coming out of all of the awful crevices and you don't even know where the next time they're going to hit.
Yes. Yeah, definitely. I always think that when you do Heilkunst, it does take a lot of courage and bravery because you have to really be willing to look at those things. Look at those things that's happened in your life, and it can be kind of scary. But what I found is because I feel like a lot of the things that I would feel guilty about. Oh, I did this, or, you know, especially where my kids are concerned. Oh, why did I make that decision? That was the wrong decision. What a horrible parent I am, or something. But it takes the guilt away because you understand yourself better, and you understand why you did the things you did, and you don't blame yourself anymore for some of those things. You take responsibility for them. But does that make any sense?
Well, yes, and you don't keep repeating patterns. And again, you've done that beautiful job of saying, you know, and the life force will always tell you when it's completed a lot of these gates and sequential therapy, it'll tell you that the life force is most interested in addressing and understanding the jurisdiction where the diseases still lie.
Yeah.
Right? The patient or the individual will tell you, okay, this is, you know, and the thing is that the case gets so clear when you peel the onion. It's like, okay, now you can really hear. It's not chaos from side effects of drugs anymore. It's not chaos because that person had that sucky job for 20 years and should have left it, you know, 10 years ago. I'm thinking of a patient recently who had a, you know, huge layer of what we call natrum muriaticum or cancer issues. Medication, you know, she's all off of now, and she's all of a sudden, you know, traveling again, and life is a joy. And she's like, oh my God, Ali, I'm having my, you know, house decorated. I'm hiring a decorator. Can you believe it? You know, I'm getting a job now that I really love and where I feel appreciated. Like things just start through sequential to actually evolve. And you get this really nice motility and movement with the case. Like I wouldn't want to be an allopath or another kind of therapist, alternative or not, because I'm not a patient woman. You know, I worked in the financial world and, you know, in corporate for years. I don't want to be messing around with patients stumbling over the same karmic roots
Right.
over and over again. It makes me crazy. I'd want to shake people, and that's just not healthy for either one of us, you know?
Right.
So it's not the patient's fault. It's the fault of the system of medicine not following lawfully the law of cure and the sequential layering of disease.
Right. Right. Mm-hmm. Which I always found interesting, going way back to Hahnemann that we were talking about earlier, is what a battle there was that went on between homeopaths, Hahnemann, and allopathic medicine.
Yeah.
And
Oh,
it's
some of
still
his
going
most
on
colorful,
today.
yeah. To read his words, yeah, are phenomenal because, yeah, he was like, you guys are totally unethical. And he called them every name in the book. It's actually, sometimes I go just to read lesser writings and such so I can get a bite. It's like, oh, yeah, oh, there's my forefather, you know, who understood, you know, how frustrating this is. And, you know, if we're really serving patients, I mean, I'm thinking of a colleague of mine, Dr. Len Levine, who was a chiropractor and an MD, came to Heilkunst and studied this system of medicine along with many other medical doctors who have done that. But Len being one of my very good friends, and, you know, he launched one of his books the same time as I did. And he said, really, it's up to the physician to be knowledgeable enough and develop the tools to serve the patient, not the other way around.
Mm-hmm. I agree.
On that note, my love, I think we should close. And thank you so much for asking such phenomenal questions and, you know, really helping me stay focused on, you know, the topic at hand and not running off willy-nilly. Being Heilkunst so damn vast, it's so easy to, you know, end up in all kinds of jurisdictions in one go. So,
well, always
thank you so much.
Good for me to hear it again. Hear all the information again, because it's good to hear. I can never hear, you always hear something different every time.
Oh, it's always
and
a
something
pleasure
else
chatting with you. Thank you so much, Sarah.
No, you're welcome. Until next time.
All right, love. Bye for now.
Bye.